Hey everyone, this is Andrew Kissin, Senior Marketing Manager for Zahn Dental. We're here with Bennett Napier with the NADL. Bennett, as of this recording on May 6th, which I think is important to give everyone a context, the ADA has continued to provide updates about what's happening in the dental industry. Can you share what you're seeing from the ADA and from the clinical side, just as a whole?
Sure, very much so. Thanks, Andrew, for the opportunity to be with you again, and hope all of the customers that Zahn Dental serves are hopefully getting back to business and getting to some normalcy. So we're hopeful that this week and continuing on, we'll see some good things moving forward over the next few weeks. So thanks again for the opportunity to share. I'll start with some high level things. I always think it's important to kind of reference data. I'm a numbers person, although I'm not a CPA luckily, but I look at the ADA Health Policy Institute published a modeling report, and that came out about 2 weeks ago. And so obviously, I think to some extent, hopefully the data would only get better based on what they came out with in terms of their model. But for planning purposes, on the clinical side and certainly the lab side, because we ride that tide one way or the other, for 2020, effectively that model is predicting a 66% decline in dental spending in the U.S. For fiscal year 2020, and it's not a one-year deal. So even going into 2021, we'll feel the context of the impact, if you will, and so they're predicting 2021 to see a 32% decline in dental spending in the U.S. And so those figures are based on kind of the pre-COVID, if you will, projections of what dental spending trends were going to be and what that means for us. So I think that's important to note. Just ADA has done a good job. And it gives us some window on our customer base. And certainly a lot of labs have applied for different SBA relief, like the Paycheck Protection Program. And I think it's important to note, we're not alone, because there were some labs that received the loans and some labs that didn't. But if you look at ADA data, we had about 74% of the ADA member respondents applied for the Paycheck Protection Program. 50% of them got approved. So it just tells you, there was no sector that, to some extent, especially in a small business sense in dentistry, that had a better outcome, if you will, just based on the nature of who they are, what business they're in. A lot of it lended to what lenders they went through. As we have seen in the news, a lot of the smaller community banks, especially on this second round of funding, fared better for some of the loan applicants. And I do think, even though it's May 6th, for those labs that didn't apply for phase 1 or phase 2, or did and didn't get approved and get a loan, we do expect Congress is going to come back with a third round of Paycheck Protection Program relief. So if people are looking for that as some potential benefit, I know a lot of labs wanted to effectively wait to apply, because that 8-week clock starts ticking once the money enters your bank. So to some extent, if labs haven't applied already, this timing may actually be better for some labs as they bring people back from, furloughs and stuff like that. So that's just something for people to be aware of. Patient volume is going to be interesting to watch the next couple of weeks in terms of the ADA data. We all know it on the lab side, where most labs were probably down 90-95% compared to last year at this time. But you basically saw that same mirror image, for dental practices, both on DSOs and solo practices, where they basically were seeing 5% of the revenue compared to where they were, March and April of last year. So everybody's in the same boat, and we're be able to get out of this rowing together. I think I'll reference some NADL data too, just that was primarily pre-COVID, but it gives us a window of kind of what we'll probably do some additional surveys this summer just to see as things progress. So every year we do a spring cost of doing business survey, and usually about 600 to 700 labs respond to that survey. And most of the responses came in prior to March 12th. But even before, COVID kind of obviously has had the impact it's had, labs were, I think, already kind of conceived, if you will, that COVID was going to have some impact. And so the issue of optimism was a question that we asked, and it was, very cautious, I guess is what I would say in terms of the outcomes. And so for, optimism and things of that nature, yeah, a good portion of the labs, 40% effectively were optimistic, a good portion were neutral, and then about 11% pessimistic in terms of what the rest of 2020 was going to look like. So I clearly those numbers will change based on, the last 8 weeks of activity. But I think the point is people were already of the mindset this was going to be a tough year, which is unfortunate since January and February, everybody coming out of Chicago Midwinter was so optimistic, and it was a phenomenal, show that week across all the different events. And so I think just exit planning too. I mean, certainly you and I have talked offline and started to see some lab closures. Exit planning is a question we ask routinely, and effectively especially for small labs, where it's more of that like 1 to 6 employees, nearly 35% of the small lab owners, whenever effectively they, determine that they need to close or want to close, so they'll just close down, meaning they're not going to sell to employees, they're going to sell to a third party. And so I know there's been a lot of social media, interaction, if you will, on what does this mean in terms of lab consolidation. And unfortunately, I think it sped up some people's timelines in terms of just with the economic conditions, sped up those timelines of lab closures, especially this last, I'd say 3 to 4 days. Just looking on social media outlets, started to see a lot more posting of, especially small, maybe 1-person, 3-person labs where they're closing down and, putting up their equipment for sale and stuff like that. So it's sad to see, but it's unfortunately it was to be expected for some people. I mean, if you look at National Federation of Independent Business data, 70% of small businesses going into this, pre-COVID, just even in normal times, have less than 2 weeks cash on hand. And that's obviously, this has been 8 to 10 weeks for a lot of people, and it's still going. So that just tells you, just unfortunately for a lot of people, it's not gonna end well. Those that have been able to ride this out, I think clearly will be able to serve the dental market in a very positive and progressive manner, and I think in collaborative manner for that matter. And so I'm still hopeful, but I just know it's going to be a long haul for a lot of people.
So, you started off with the decline in the numbers about, not just this year, but the next few years just continuing to linger. And then you add on top some of the closures of, any labs, right? A one-man lab, or it could be a 10-man lab, or it could be larger. Who really knows everyone's financial situation? But, what about, or at least what do you think about the patient demand, right? Like at the end of the day, people still need crowns. People will still need bridges, implants, dentures. Doesn't that just mean more work, less labs, or from the ADA report?
Yeah,
Are you?
certainly. I mean, yeah, long term, I mean, certainly it's a supply and demand issue. So it's not an issue of our patients going to come back. They're going to come back. It may take a little longer for them to, kind of come in a groundswell, but I mean, they're coming back because they have treatment that they need. They have elective procedures that they want to have done. And, certainly, the harsh reality is, some dental practices won't make it. Some labs won't make it. So from a supply and demand issue, certainly long term, I think, that again, if you look at it from a business perspective, it is a good place to be. It's tough right now, but I mean, there's no sector that hasn't, been impacted. We're not immune to it like anybody else. But I do think your point's valid that labs that are able to look at this from a strategic standpoint and look at other opportunities to either expand their relationships with existing customers, or certainly look at new customers. There's going to be opportunity there, and so I think marketing and branding is clearly always important. I think labs, if they're smart, will, as part of their kind of strategy over the next 6 to 8 months, look at how they're putting their message out there and to whom, and probably will be able to look at some additional expansion in terms of organic growth and new client growth. So I think that will help labs clearly. Because I think the reality is, from a diversity standpoint, every dental practice is probably going to see, as we just looking at that data from ADA, every individual dental practice is probably going to see less revenue in 2020 than they saw last year. So from a mathematical standpoint, the only way for the lab to, minimize or mitigate that impact on themselves is to go out and expand the number of accounts that they're working, and kind of close those gaps. And so that will help for the short term. And then in the long term, if they're able to service those new accounts effectively, that'll be very good. As an aside, we did ask, again, this was pre-COVID, but we asked a new question in our business survey this year related to client retention. And so we asked questions related to, how many of your clients that you got in the last 12 months have you retained? And then we asked basically a metric on those that you've had, that you acquired over the last 1 to 3 years. Again, how many of those are retained? And so, what I would share with you, and this was pre-COVID, is that it was actually a pretty resounding success in the standpoint that, we always talk about churn and of clients and stuff like that, but probably 2/3 of labs, have been able to maintain new client accounts, and so that's a good testimonial in the sense that if they're providing good quality service, good turnaround, good communication, once you get a client, that you're usually able to retain them. So I think that's some silver lining that is good for existing accounts, but also acquisition of new accounts, that it's not probably hopefully going to be a one and done. You go get this new account and have them 6 months and then they go somewhere else. That if you're living your brand effectively, you're likely to be able to retain those people for a longer term.
Yeah, and you mentioned branding and marketing, but at the end of the day, and what you just said is, we all know this is a relationship business, and if you continue to service those relationships, ideally you have those accounts long term. I think there will also be an opportunity to reassure the practice or even the patient of, just following guidelines for disinfecting, and just that the lab has implemented some kind of procedure, if not already, because everyone, there should be procedures in the lab already to disinfect and quality control cases. But now more than ever, there might be a need to really show the documentation of, this is what happens when a case comes in the lab and what happens when it goes out, so that everyone is just more comfortable with receiving the case.
Sure. I agree with you wholeheartedly. I mean, just, whatever labs are doing, because labs are doing something and always have been as it relates to standard operating procedures or protocols on infection control, and this is not the time to kind of keep that a secret. So, if they have a really robust program of, how they do it, why they do it, their training elements for their staff, this is the time to tout that stuff, and I know, we always kind of take that stuff for granted pre-COVID, but this is the time to highlight that, because it's only going to help your customer instill confidence in the patients, and help them as another component of, hey, this is a safe place to come get your care. The partners that we work with to help deliver the care, they're safe in what they do and how they do it. So I mean, just don't be shy. If you have something that's really compelling in terms of what you do and how you do it, share it. Share it as best practices, and even work with your clients to provide maybe some flyers for the patients. Just a little bullet point list, simple top 10. This is what our lab partner does. This is another area where you can have some confidence and in the quality of who we're working with and who we select to work with. I think that's easy to do, and only benefits everybody in the mix.
So as of today, we're heading back into kind of the unknown a little bit, where more states are starting to reopen and relax some of their social distancing. Any parting words or any foresight on what you've seen or what's coming, or any advice to dental labs that might start easing back into the workforce?
Yeah, I think this isn't a political statement, but I because everybody's got a different perspective on when we should go into different phases of phase 1, 2, or 3. depending on what state you're in and how they define it. But I think clearly the healthcare community is always going to be in a different boat. So I think, especially because we're talking about patient confidence, that we will, the laboratories and the dental practices are probably going to need to extend, the best practices probably longer than some sectors, just by the nature of the close proximity of, patient care. And so I think that's important for labs, just to be aware of that. And even for internally in the lab, it's an important issue in terms of just, employee morale and, workforce culture, and just well-being for your workforce is, as long as you can, maintain best practices that, that are reasonable, and can be accommodated, that don't interrupt and disrupt the delivery of quality services. They're things that just will, I think, help people be, I'd say, more comfortable working, coming back to work. And, again, especially on the clinical side, in terms of that relationship, I think there's going to be an expectation, because it's, patients, based on their own thought processes, are going to approach this differently. So you're always going to have a segment of patients that are going to be kind of, if we look at the technology, early adopter and late adopter mindset, we're going to have patients that, run back in, and we're going to have other patients to say, I'm going to wait and see. And so I think if we can work with our clinical partners to maintain some of those things that we're doing right now at a really high level, and hyper intensity, if we continue to do some of those, I think that will help bring that other segment of the patient base back quicker, as opposed to dragging us out much longer, which is not what any of us want.
Great. Bennett, well, it's always a pleasure picking your brain and hearing everything that you're seeing and hearing in the dental industry. Look forward to it. Stay safe, and really, really appreciate your time.
Thank you. Thanks to the Zahn Dental team. You guys have been wonderful putting out information, and just trying to help your customers on everything from, just business and finance and everything in between. So thank you for what you're doing.
Yeah, we're here to help them. We're all in this together, right?
Thank you.
All right.
Thanks, Andrew. Take
All right.
care.